لازم تشتغل بسرعة.
You paged me?
Patient is a 9-year-old girl, crushed lower right extremities. Saleh called with a few questions. We really need your help.
What do I need to know?
هذا رفيقي Dr. Hunter. This is Saleh. We work together in Syria.
Hello, doctor.
A severe soft tissue injury progressed by gangrenous limb. He's pulled over on the side of the road and needs to perform an above-the-knee amputation right now.
With what tools?
I have scalpel, scissors, clips.
Hemostatic clips.
Yes. Dressings and a handsaw.
Ketamine for sedation.
Can you show me the girl again?
She weighs maybe 20 kilograms, Dr. Hunter.
All right, try 20 megs if you have that. 20 milligrams.
Done.
Okay, Saleh. If the tourniquet is tight, make your incision. Start by dividing the skin circumferentially.
قبل ما تقطعها قص الجلد بشكل محيطي. Good. Now cut through the subcutaneous tissue.
Okay.
You're doing great.
في كتير دم ما بقدر اسيطر عليه.
خليك هادي يا اخوي. تأكد انه الرباط ما ارتخى. شوي شوي.
Room 305.
You've got to go to that bash.
I can't leave him.
Saleh, you think we can do this? Just you and me?
Okay.
Well, no, something might get lost in translation.
Bash. We got this, okay? Go.
Room 305.
Thank you, Theo. انت بأيادي أمينة.
I finished sewing. There's blood everywhere.
Tighten the tourniquet. Apply the hemostats to the longitudinal structures that are likely to be the major blood vessels.
Hemostats do. I'm sorry.
It's the structures that look like... So, the leg, and the blood vessels.
Blood vessels, yes.
Okay? Yes, the structure of the blood vessels.
What happened?
Acute respiratory failure. We need a non-rebreather at 15 liters per minute and a stat portable chest.
Chest tube's not working. O2 stats?
66, respir's 40, tachy's at 144, BP's 8460.
Prep a new tube. If it's kinked, we'll have to reinsert.
Chest tube's definitely not working. Tension pneumothorax.
Your colleagues were all here before you.
Sorry, I got held up.
If you can't be here in time, we don't need you. Insert a new tube. She'll settle.
You're sure? Just try again. Keep at it. Show me.
Here. Did you see it?
Good.
What do I do now?
Okay, now keep the tourniquet in the position and
Okay.
just examine for obvious blood vessels, then clamp with your hemostats.
Okay.
That was fast. She's okay.
Dr. Hunter, there's oozing.
No, that's normal. Just keep an eye on it. Yeah, if it continues, you just need more pressure on the dressing.
Thank you. Thank you both.
Well done, Saleh.
What the hell's going on here?
9-year-old Syrian female crushed lower extremities after a building collapse. Rapid onset of GFM after tourniquet and rescue.
A volunteer medic successfully performed a roadside amputation with almost no equipment.
Prognosis?
She's responsive and stable. He saved her life.
Good. Find me before you leave.
Who was that?
The big boss.
Call me when you get to the hospital, Saleh.
ماشي.
Yalla.
You do that kind of thing a lot?
Not anymore.
People don't like you when you throw up on the bus. My purse and phone, I had them when I talked to that nurse. Did she put them somewhere?
We'll find them. How long has this been going on? Miss Harper? Irene? The vomiting and the abdominal pain? When did it start?
A few days, I think. Maybe this morning. I didn't want to miss my shift today. I
Thought it was the flu. But it's worse, right?
Put your hands up for me, Mrs. Harper. Thank you.
My kid. I'm supposed to pick her up from school later. I need my phone so I can... My husband doesn't know where I am.
It's okay. We'll take care of that. Atwater wants me to let you weigh in first, so...
She's confused and disoriented, hypotensive and tachycardic. She's jaundiced. I'd be concerned with liver injury.
Yeah, but those symptoms could also describe biliary tract pathology.
But not the trembling hands. The asterisk 6 can mean acute liver failure. We should do testing to confirm. Given her level of consciousness, I'd suggest an aggressive approach. Intubation sooner rather than later. She could go into multiple organ failure. Do you want to do testing first?
We need blood. CBC, LFT, all of it.
Okay.
Irene Harper, INR's 2.1 billi elevated.
Her liver's failing. You know the procedure?
Screen for hepatitis and acetaminophen.
LOC?
Signs of hepatic encephalopathy. Her O2 stats are borderline.
If she's unconscious, you need to intubate. She could go into multiple organ failure.
We need to pre-oxygenate. Then give her 100 ketamine and 100 sucks.
She's apneic.
Laryngoscope. Endotracheal tube. I can't visualize her cords.
Airway edema?
No, cords are anterior. Let's back off and bag her for a second. I should call respiratory therapy.
Do you have light ones in here?
Bottom shelf, I think. Yeah, why?
With the lighted stylet, you'll be able to guide it through the tube.
No, I don't have a view.
You will now.
When you said working in the dark, you meant literally.
Occasionally. Do you need suction?
No. Could you just...
Come.
Did you ever think all that would lead you here?
What led you here?
Everything okay?
Yep, tough airway, just got it.
We don't intubate with light wands anymore.
I propose it.
Next time, call RT. Now let's figure out what's causing her liver to fail.
The bruising speaks to rapid deterioration. She wanted her family. Do you know if they've been contacted?
No. Update her chart, then see if the social worker did that. I'm gonna run down the rest of her labs.
How's my wife? How's Irene?
Well, she doesn't have hepatitis, which means the differential is wider than we thought.
We're keeping her stable, but we need to see if she's been exposed to any toxins which could affect her liver.
Does she drink?
No more than anyone.
Any drug use?
You think she's on drugs? No.
What about something she ate?
She ate what we always eat. Chicken, salad. I don't know, okay? Irene takes care of herself, of all of us. Okay? There's no fast food, no junk.
What about her workplace? Is she employed?
Yes, she's employed. Okay, she cuts hair.
Hair dyes, chemicals. If we can narrow down the tox screen.
Can you help her?
First, we need to determine why your wife is sick.
My wife. Have you seen her? I've been here 6 hours.
Unfortunately, your wife's condition hasn't changed.
What I said to you before. I'm not racist. That's not who I am. I was just scared.
I know. Mr. Harper, are you feeling okay? Do you need to sit down?
No, I'm fine. Listen, when can I see my daughter?
Sir, can you hear me? Arnold! He was starting to look jaundiced and losing consciousness like his wife, and his airways compromised.
We should resuscitate and intubate.
100 ketamine, 100 sucks.
Heart rate 110, BP's crashing.
I need 2 large bore IVs. Let's get this patient 2 liters of NS, stat, CBC, chem, coax, LFTs, and cross-match 4 units red cells. IVC's flat. He's hypovolemic, but no signs of free fluid.
Hematemesis. He has genetic varices. Elevated INR will cause this kind of sudden bleeding.
Which would mean his liver's also failing.
And whatever caused Irene's problem is affecting them both. Get Dr. Hunter to check on the daughter. On it.
Where is that water?
She's with a patient on 6.
I need a Blakemore kit.
What?
This man will bleed to death if we don't get a Blakemore now.
Okay, got it.
We can't put in a Blakemore without an attending.
That water's on her way.
His heart rate is through the roof.
Blakemores are incredibly risky. We don't use them except in...
As a last resort, and if we don't do something now, this man is going to die.
Have you ever seen one work?
Yes. And if this one's going to, we don't have another second to waste. 4 units, O negative.
No pulse, he's in cardiac arrest.
I need a board. Arnold on 3. 1, 2, 3. 1, 2, 3.
1 amp epi. Keep giving packed cells. When I inflate it in his stomach, it should stop the bleeding.
Okay, he's been down for 25 seconds.
What the hell's happening here?
Massive hematemesis and hemorrhagic shock. He just lost his pulse.
You sanction this?
He wasn't protecting his airway, so I put in a Blakemore.
Okay. Pack cells through the level 1. Pass me the OG tube and get out of the way. Needs a proximal balloon up as well. Dr. LeBlanc, you stay. 1 gram TXA.
50 mic octreotide.
Go!
Need to keep Leila overnight and monitor, otherwise they'll send her alone to strangers.
Well, she can't go home because there's obviously some kind of exposure, but she's not symptomatic, so it can't be airborne or water, but... Could it be food? Father says they eat healthy. Produce has pesticides.
Maybe, although Leila's not sick.
What are you thinking?
She picked off all the vegetables on her pizza.
So what did they eat that she didn't?
Well, let's find out.
No, you can't. After what you did, they want you in the suture room for the rest of your shift.
Dr. LeBlanc, Leila's all alone. She's afraid of losing everything, so if you push too hard, she'll shut down.
Everybody calls me Max. Hey, Leila. I'm Dr. LeBlanc. Leila's feeling pretty quiet right now. I need help narrowing down what her parents might have eaten.
Leila, could you answer a few more questions about your mom and dad for Dr. LeBlanc?
Can I color with you?
I'll go get her some water.
That's a nice tree. This hospital's really big and scary, huh?
I wanna go home.
I know. When I was your age, I had to spend the night in a hospital, too. Lots of times, actually. But you know what? I found out that hospitals are full of people that want to help. So when I grew up, I became one of the helpers. And Leila, there may be something that your parents like to eat that you don't, and that's what's making them sick. And if we could just find that one little thing, maybe I could help them feel better. Do you think you can help me do that? Leila picked out vegetables with her father at a community garden. Leila doesn't like mushrooms. Her parents do.
We were able to confirm that the toxin that you and your wife ingested came from wild mushrooms.
I picked those mushrooms. This was all my fault.
Well, you're both responding to treatment well. It will take some time, but...
Maybe. They were right to judge me.
No, they weren't. People can think what they want to think, but you know who you are. A man who loves his family.
Okay, Naomi, this is gonna be cold. Let me know if I'm pressing too firmly. Okay, I'm gonna have to scan to confirm, but you're hemorrhaging inside. Which means our first priority right now is to get you to surgery.
How's Jules gonna find me?
Look, if she's here, our support staff are gonna find her and they're gonna tell her where you are. I'll ask them to myself. But for now, I really need you to stay as still as possible, okay?
was that?
It's power grid kicking in. We've been on generators since the explosion. Elevator should start up again in a second.
Why isn't it?
I don't know. Naomi, where does it hurt?
My neck.
Can you describe it for me?
It's tightening, almost like I'm being choked.
We saw the hematoma earlier, but I do see increased swelling right now. Likely residual effect from impact trauma.
What do we do?
Gonna be fine, okay? It's an internal hematoma, which is now swelling quickly.
A blast injury? Arterial?
A venous collection. And it aggravated when the elevator stopped. Dr. Bishop, if it's pressing on her airway... How long until somebody can get us out?
When the power came back on, the surge blew part of our grid. We got 2 elevators down, only yours was in use at the time. Mechanic was working with fire and rescue, but you're between floors, so it's delicate.
Sir, if the swelling continues, we lose our shot at intubating her.
Well, you need to be prepared to act before that happens.
You mean open an airway without imaging? Sir, even if I could approximate an incision point, I don't have the proper tools.
Well, let's hope it doesn't come to that. How fast is the swelling accelerating?
It's doubled in the last 9 minutes.
Well, if it keeps accelerating at the same rate, you won't have another 9 minutes.
If I don't make it, I need you to tell Jules. If I knew this morning was gonna be the last time, please tell her that I love her.
No.
What?
I'm not gonna tell your wife you love her because you will. You will. All I need to do is make an incision distally. Then I'll quickly insert a tube.
Dr. LeBlanc.
Poor hemostatic technique can increase the risk of intervention.
Max!
So I have to be careful to apply pressure
Max!
approximately. What?
Where do you spend every waking moment of your days?
In this hospital.
Exactly. And when you're not here, what are you doing?
Reading.
Reading what?
Medical textbooks. I've read 3 studies on this procedure, and I've watched every video available online. You're the one always telling me not to overthink, but I'm ready for this because of all the work I've done.
I agree.
You do?
If I was stuck in an elevator with a hematoma, no imaging and no tools, I'd be lucky to have you there to handle it.
I'm gonna do it now.
Slow and steady.
It's working. It's working. Her O2 sats are rising.